Hello, this video is intended to instruct you, the healthcare provider, on how to obtain an effective medication history. The advantages to obtaining the interview are that you will gain an opportunity for continuing education, rapport with other professionals, and professional development. Establish trust and willingness to communicate with the patient, thereby improving effectiveness of care. Empower the patient to play a major role and vigilant role in their own health. Consider the patient's over-the-counter medications and allergy information to not waste valuable time and ultimately to decrease medication errors. Some deterrents from obtaining or implications of neglecting a medication history can cause misdiagnosis of patient with resultant liability issues, costly coding and billing by medical insurance carriers, failure to properly document, communication language barriers or generational gap, no documentation of OTC medications and supplements can lead to reactions with prescription medications. And also, another disadvantage is that it will be an inability to properly understand the reasoning for occurring side effects, an assumption that could be made that prescription drugs are the source of the side effects, when in fact the over-the-counter medications could be the cause.
Now that you know the advantages of obtaining and disadvantages of not obtaining a medication history, here are the guidelines to obtaining an effective medication history. Introduction. Introduce yourself, verify patient information, name, date of birth, and address. State the purpose of the meeting, inquire about current health, how are you feeling today? Gather your information before they arrive, if possible. Obtain current medications. How to obtain information would retrieve prescription information directly from the gatekeepers. Retail pharmacies, pharmacy benefit managers, centers for Medicare and Medicaid services, database for Medicare Part D, hospitals, family members, and caretakers. Prescription, over-the-counter medication, herbal supplements, home remedies, dosing. Make sure to get the dosing, the drug schedule, the immunizations, the drug allergies, and drug intolerances. And make sure to get any side effects to any medications. List diseases of the patients. Have a good basic understanding of the disease state. Make sure they have basic understanding of their own disease state. Ask them if they know why they're taking their medications. Ask if they know anything about their disease state, why it is important to take their medication, and make sure to indicate any FDA indications for each prescription. You must communicate effectively, how they are adhering to their medications regularly, why is it important to take their medications. Make sure they tell you if they are taking any other over-the-counter medicines or any home remedies. Maybe they are not coherent with medications. Make sure to ask why. How they feel about also ask how they feel about having the disease state. Ask open-ended questions so you can get the most amount of information in the small amount of time you have. Reducing the risk and patient safety. Assign high-risk drugs, assign high-risk doses, assign drug-drug interactions, drug-food interactions, and make sure to list any precautions. In closing, tell the patient what they are doing right to keep doing it, and make sure to tell them they're doing a job well done. Make sure to motivate the patient. Come up with some medication lifestyle goals with new or existing disease states. How to reach new medication and lifestyle goals, and how to keep medication and lifestyle goals. Schedule the next appointment and make sure to thank the patient. Patients who require more attention when obtaining a medication history. Patients with multiple pharmacies and physicians, geriatric patients, and patients with chronic illnesses require multiple medications. Outpatients require more scrutiny than inpatients.
Hello, my name is Vivian and I'm the pharmacist. How are you feeling today?
I'm okay. How about you?
Good, wonderful. Could you please verify your name, date of birth, and address for me, please?
My name is Sunrise Smith. My birthday is 10/10/85. My address is 3248 West Laverne.
Okay, good. Thank you very much for that information. Now, I would like to go over your medications with you to make sure that everything is okay. It should take only about 5 to 10 minutes. Is that okay with you?
I'm actually in a rush to go, but I guess I can spare a couple minutes.
Great, thank you very much. So can you please tell me what medications you're currently taking, and please tell me the strength and how often you are taking them?
I am taking warfarin sodium 2 milligrams. I take that once a day. I'm also taking, I believe, Nexium 40 milligrams once a day. And I was taking amoxicillin 500 for an infection that I had, but I stopped taking that a few days ago.
Okay. And how often do you forget to take your medications?
I mean, I've been very good with it, except I've been really busy with school lately.
Okay.
But not that much.
Okay. So, did your doctor tell you why you're taking the Nexium, the amoxicillin, and the warfarin?
Well, I'm taking the amoxicillin. I told you I had an infection, but I mean, it went away after 3 days, so I just feel like it was unnecessary for me to continue taking the amoxicillin.
Okay.
The warfarin sodium, I'm taking it for blood clotting, and the Nexium, sorry, I had for heartburn.
Okay.
Yep.
Okay, and how do you take your medications? You usually take them with lots of water, food, do you sprinkle it in applesauce or anything like that?
Just natural by mouth, water,
Okay.
glass of water
Okay.
for all of them.
But what about the Nexium? Did your doctor tell you any special way that you can take that?
Capsule by mouth.
Okay. All right. How would you describe how you feel after you take your medications? Do you feel dizzy, sleepy, or tired, or anything like that?
No, I think I tolerate these medications pretty well.
Okay, that's good. Do you use any over-the-counter medications or vitamins right now?
I am taking vitamin K, and I think I'm also taking Prilosec as well.
Prilosec, okay. And what are you taking the Prilosec for?
Heartburn.
Heartburn? Okay. Do you have any drug allergies?
No, I don't believe so.
No? Okay. All right, Ms. Smith, thank you very much for all that information. Now that we have your medications, you've listed those for me. I do have a couple of concerns I would like to address with you. I was thinking that maybe you can talk to your doctor about your heartburn so he can change or increase your Nexium, because the Nexium and the Prilosec that you're taking over the counter, they actually work the same way. So it seems like you might be getting a double dose of the same drug, okay? So what you can do is you can call your doctor, give him a call, see what he has to say about that. And in regards to the heartburn, you can try taking the Nexium an hour before you eat, because it has been shown to work better that way. And another thing you can do, instead of excuse me, I'm sorry. Maybe you can call your doctor again and check with him to see about the infection, about the amoxicillin, because I know you said it went away, so you stopped taking it, but you want to verify with your doctor just to make sure that he's okay with you stopping it, because I know for the most part these medications, you're supposed to use them, so they're completely gone. So you can check with your doctor, see what he has to say about that. Okay? And also in regards to the warfarin that you're taking, you also said you're taking vitamin K over the counter. So what you can do is, again, talk to your doctor about that, because I'm a little concerned about the vitamin K, because if you're concerned about your vitamin K level, which is why you're taking the vitamin K, I would talk to my doctor about that and see what he has to say, because the warfarin and the vitamin K, they kind of, they don't go well together, okay? So you want to talk to your doctor just to make sure you're not doing anything to harm yourself or anything like that, okay?
Wow, I didn't know things are that complicated. Oh wow, good thing I stopped by.
Okay.
Thank you for your time.
Oh, you're very welcome. And another thing, I know you said that you sometimes forget because you're busy with school now and everything. I know with me, what helps me usually with my medication is like if I carry it with me. And sometimes I might set an alarm on my phone to remind me. So you can try that and for the next week or so and see if that helps you to remember to take your medications, because these are very important medications. So we want you to take that and get better.
That's a great idea. Thank you so much.
No problem. So again, would it be okay for you to check back with me in 2 weeks just to kind of see how everything is going?
2 weeks,
That'd be
of course,
possible?
definitely. This
Okay.
is the most awesome, useful information I've gotten.
Great. So we'll see you then. Thank you very much for your time. You take care of yourself.
Okay, thank you.
Bye. Obtaining a medication history is something we should all be able to effectively do. Now that you've seen the video and an example, you have tools that you can use to try these steps at home and carry them into your practice to be the best healthcare provider you can be. Together, we can make a difference in decreasing medication errors. Thank you very much for watching, and good luck.